University-trained physicians in the Middle Ages were terrified of this one man. He wasn't a rival scholar. He wasn't a knight with a sword. He was the barber-surgeon, the man you went to see for an aching tooth. While educated doctors were reading ancient books, these barbers were on street corners pulling teeth on a stage for a crowd. It wasn't medicine. It was a public performance. They used brute force, showmanship, and a pair of dirty pliers. The physicians considered surgery to be butchery, something far beneath their status. They wouldn't dare get their hands bloody. So they feared the barber-surgeon not for his knowledge, but for his audacity to do the dirty work they wouldn't. This created a fascinating power dynamic, begging the question, why was the most practical healer also the most feared? To understand this fear, you first have to understand that medicine in the Middle Ages was split in two. On one side, you had the physician, a man who had spent years at a university like Bologna or Paris studying the ancient texts of Galen and Hippocrates. The physician's world was one of theory. He diagnosed imbalances in the four humours: blood, phlegm, black bile, and yellow bile. He prescribed herbs, diets, and prayers. Crucially, his work was intellectual. It was clean. To a physician, cutting into a human body was messy, undignified manual labour, no different from being a butcher or a carpenter. It was work for the lower classes. And on the other side of that line was the barber-surgeon. These were not university men. They learned their trade through apprenticeship. They were the masters of the physical body. They could shave a beard, lance a boil, let blood, set a broken bone, and pull a rotten tooth. They did the bloody hands-on work that physicians considered beneath them. They were craftsmen, not scholars, and the tooth was their domain. So what actually happened when you had a toothache? You didn't book an appointment, you went to the marketplace. The tooth puller, often a travelling barber-surgeon, set up a stage, not just to treat patients, but to draw a crowd. Your personal agony was public entertainment. The tools were not designed for finesse. They were designed for one thing: leverage. The dental pelican, named for its resemblance to a pelican's beak, would hook under the tooth. The practitioner would then twist, brutally ripping the tooth from its socket. Even worse was the tooth key, which applied immense rotational force. The goal wasn't a clean extraction. It was simply to get the tooth out by any means necessary. There was no anesthesia, no painkillers. The patient was wide awake, held down against the unyielding force of the extractor. The sound of a tooth cracking, or worse, the jawbone itself fracturing, was common. The force required was so great that shattering the tooth, leaving infected roots behind, was an accepted risk. Massive bleeding was a given. A fatal infection from the unsterilized tools was a coin toss. Now your experience depended heavily on your station. A wealthy lord could afford to have the city's best barber-surgeon visit him in private. He might be given strong wine or a distilled spirit to dull his senses, and the practitioner might have slightly better tools. The procedure was still agonizing, but it was private. But for a peasant, a servant, or a common soldier, the reality was the marketplace stage. Your suffering was a spectacle. The tooth puller was a showman, often extracting teeth from several people in a row to prove his strength and skill. It was the lowest, most brutal form of public health care imaginable. So, we come back to the fear. Why did the learned physician fear the tooth puller? It wasn't just class snobbery. He feared him because the barber-surgeon represented a power he did not have. A physician's power was in theory, in Latin, in mystery. The barber-surgeon's power was visceral, immediate, and terrifyingly real. He could physically dominate a person in pain, wrestle with their body, and stand calmly amidst the blood and screams. This public brutality shaped the medieval mind. It created a society where extreme pain was not only expected, but was a form of public theatre. It reinforced the idea that the body was something to be battled with, a vessel of corruption that sometimes required violent intervention. The man willing to perform that violence, the barber-surgeon, held a unique and fearsome place in the social order. He was both a necessary healer and a figure of dread. We live in a world transformed by science. Anesthesia, antibiotics, and an understanding of microbiology have turned one of history's most feared procedures into a routine appointment. We have separated the brute force of the past from the medical science of today. And yet an echo remains. That little knot of anxiety you feel when you hear the dental drill, that slight fear of the chair, it's not irrational. It is a deep, ancient cultural memory. You're not afraid of the skilled professional in front of you. You're afraid of the marketplace showman with his rusty pliers. You're afraid of the drumbeat, the screaming from the crowd. The next time you sit in that chair, take a deep breath. That faint anxiety isn't just yours. It's the ghost of a world where the only cure for a toothache was a terrifying public display of brute force.